Well, as folks start to trickle in, we just wanted to say welcome. We're so excited to be holding this webinar today with you. We'll get started in a minute, but we'll just let folks kind of filter in as we see our numbers growing down at the bottom. Hope everyone's day is going well so far. We'll jump in with just a little bit of housekeeping at the start. Once again, welcome. Thank you so much for taking some time out of your day to join us for our next Public Health Essentials for Health Departments webinar. We are a proud crew with partnership across the Pennsylvania Public Health Association, the FIG Infrastructure Network, of course, us at PHMC here as well. And we have supporters from NACCHO, County Health Rankings, and ROMAS in the past. So it's been a lot of combined effort to make these webinars come to fruition, and we're just really excited that you're here to join us. Just a few moments for housekeeping. Just as you all know, on Zoom, we have captions available. Feel free to ask questions there's a Q&A function down at the bottom. If you have any technical issues whatsoever, feel free to drop us a note in the chat. And then also, if you have time to take the eval survey at the end of the session, we would so appreciate it. So without further ado, I'm so excited to introduce you all to Robin Wilcox. So Robin has been an incredible partner to PHMC for the past 3 years. Natalie and I have gotten to work very closely with Robin through the public health infrastructure grant work, but Robin has done so much more beyond that work too. She's had 13 years as the Chief Program Officer at the Public Health Accreditation Board, 15 years in the State Health Department, and years of work with hospitals and academia and nonprofits. So without further ado, that I pass it over to you, Robin, to lead us in today's webinar.
Thank you so much, Audrey, and thank you everyone for attending this. Good morning, good afternoon. Thank you. I hope you're really interested in job descriptions. So next slide. So job descriptions, and I know they're really exciting. This is a really exciting topic. I'm excited about it, but it's also a really important topic. Every employee of every health department has a job description, or they should. And I'm sure that you have a job description and it's filed away somewhere and you probably haven't looked at it for a while. So let's talk about all of that. Let's talk about job descriptions. Let's talk about, next slide. Thank you. What's the purpose of a job description? Why do we have them? How do we use them? How is a job description developed? What's a good process for developing a job description? What are some tips to keep in mind as you develop a job description? And what are the resources out there that will help you decide what to include in a job description, what the content should be, and what sections should be included in a job description, and then what information should be included in each of those sections. And then at the end of the presentation this morning, this morning, we will introduce to you some new resources that are available to you as you develop job descriptions. Next slide, please. Thank you. So what's the purpose of a job description from the health department's perspective? Well, they ensure that everyone is informed and they understand the roles and responsibilities in their position. It's in writing and it's formal and it's approved. Job descriptions not only spell out the expectations of a position, of the person in the position, but also the boundaries of the person in that position. The job description, I hope it's obvious that it's not written for an individual and the individual that's going to be or is in that position. It's written for the expectations of the position, for the individual in that position to fulfill, though it can be used by the individual as a basis for annual evaluations or goal settings or the development of work plans. Now, it implements your organizational chart in your health department. So it assures that all of the responsibilities for the health department are assigned to someone somewhere. So think about all of the job descriptions in total together actually make that organizational chart come alive because it provides the details of where things will happen and with what levels of authority. Now, job descriptions are also a tool for your human resources staff. It documents it. It makes it formal, as I said. It's good to have in place in the case of future potential complaints or disputes or any charges that a staff person might file. It's also really important for your HR staff in terms of any initiatives that they might want to have in your health department, particularly around employee satisfaction and employee retention. For example, if they want to do stay interviews in the department or 360 reviews or a mentorship program, it's very important at that time that the human resources staff have up-to-date and current job descriptions, or the project has to stop and they have to go back and update everybody's job description. So it's really important to keep job descriptions current and accurate. Next slide, please. So from the employee's perspective, why is it important to have a job description? Well, clearly, it's always important for all of us to understand what are the expectations for us at work. So knowing what the expectations are and having it in writing and having it formal is an element of job satisfaction. And job satisfaction, obviously, is an, I hope obviously, is a part of employee retention. Now, the job description can also be used as a way to communicate to that employee how they contribute to the department's mission, not just the ABCDs of what they do, but how those ABCDs contribute to the department being successful in achieving its mission. The job description can also be written to include the department's core values. So, for example, if a department's core value is community engagement, then as you write the job descriptions, you can make sure that community engagement and involvement with the community, mobilizing community assets, all of those are built into the job description. And that's really important from the employee's perspective to understand I'm not just doing these activities, but I'm actually living the department's core values. And then for the employee, it's also potentially something to think about in terms of professional development. They may look and see, these are the things that I'm responsible to do in this position. And I understand that I could use some strengthening in X, Y, or Z area. So it can be part of professional development, which again is part of job satisfaction and employee retention. So next slide. So let's first talk about developing the job description. Then we'll talk about what should be included in the job description. So who develops that first draft? It's kind of, oh, I'm looking at this blank piece of paper and I have to write a job description. Who should do that? In a way, it doesn't matter. It has to be appropriate for the job. Perhaps someone in a leadership position saw that there's a gap, that there needs to be some support activities, or there's a gap in activity. And so they get approval for a new position, and then they know what they want, so they write that first draft. Or, for example, it may be that the health department has received a grant from a community foundation, and included in that grant is a new staff person. So in that case, the person responsible for that grant would write the first draft. Or it might be the person in the position is looking at it to update it or revise it. So when I say it almost doesn't matter, there are two things to keep in mind. It almost doesn't matter because as you write that first draft, know that that first draft is not going to be the final draft. It's going to go through multiple reviews and several drafts. It may need, if your health department is part of a city government or a state government, it may need government approval. It's going to be tweaked. So it is important in that first draft to try to make it as comprehensive and complete as possible, but know that that's not going to be the final draft. It just isn't. It's too complicated, and there are too many twists and turns for the first draft to be the final one. The other thing to keep in mind as you're developing a job description is that to try to keep it accurate, keep it clear in terms of what the person is actually going to do. And then we suggest that the job description be reviewed and perhaps revised on an annual basis. And I'll mention that a couple times. So next slide, please. So what are some basics when you're faced with that blank piece of paper and you're going to write a job description? Well, one basic is that your health department is going to have one template or one format that's used for every position in the department. All the job descriptions are going to look basically the same, from the health department director throughout all of the levels. One format for the entire department. So what you include in one job description is going to be included in all of them. It's really important as you write the job description to keep it simple, keep it straightforward. We suggest that wherever possible, you use lists that are bulleted statements. I've seen some job descriptions that include long narratives, and you have to weed through them, and then you look at this sentence and you're wondering how it applies within the context of something else, and it's open to interpretation, which is you really don't want. So keep it simple and straightforward, and don't be too prescriptive. Say what is the person in this position is responsible, but not how they're going to do it, because you want to allow some flexibility for the person in the position to employ some innovation, to be creative, to have some professional autonomy, to incorporate quality improvement into what they're doing. So you want to not have it really specific in terms of how it's done. When you're developing the lists of responsibilities, think about the verbs that you use. Think about your language. We're used to using what people consider sort of masculine verbs of driving something and directing something. But think about how the language that you use can be gender neutral. And some examples might be to collaborate and negotiate with organizations in your community rather than direct them. Now, you're also going to want to have vertical and horizontal congruity and equity. Now, what do I mean by that? Let's look at horizontal congruity. Look at your organizational chart, picture it in your mind. And if you have a position, for example, a community health educator under environmental services on one side of your organizational chart, and a community health educator under maternal and child health on another part of your organizational chart, you're going to want to have some equity with those positions in terms of qualifications and the kinds of levels of responsibility and authority, some equity across the horizontal part of your organizational chart. Now think about your vertical, your columns, so to speak. You want vertical congruity and equity also. So if one job has responsibility around something, you're going to want to make sure that that particular responsibility is also evident in the job above it, in that person's manager or supervisor, and in the leadership, so that it makes sense as you look down that everyone is responsible for the same kind of thing, but at a different level of authority. So you're going to want both vertical and horizontal congruity and equity across the job descriptions, because as I said, the job descriptions bring to life your organizational chart. Now, a third thing as you're developing, or a final thing as you're developing your job descriptions, you don't have to make it up from scratch. It doesn't all have to come out of your brain. The basics do, but then borrow from sample other departments' job descriptions and job postings. You can borrow ideas and wording. Don't be shy about looking at other departments' job descriptions for ideas and suggestions. Next slide. So here are some of those resources for job descriptions. As you're developing your job description, you start with what you need, but then you're going to access some of those resources out there to make sure that the job description is comprehensive and it's complete. And one of the places you're going to look for, where can I find other health departments' job descriptions that I can steal from? Well, one place is there's a website from the Massachusetts Health Officials Association where any health department, local health department in Massachusetts can upload job descriptions. If you've worked with Massachusetts, you know it's a home rule state. They've got a gazillion local health departments. So that there are some job descriptions on there. Region 5 Public Health Training Center has developed a very comprehensive, well thought out repository of job descriptions. They've gone through focus groups, and they've done it from an academic perspective. It's a very good group of sample job descriptions. The Public Health Foundation has some job descriptions on their websites that incorporate the core public health, core responsibilities for public health. And we'll talk about that a little bit more. And the Pennsylvania Public Health Association soon will have another repository or group of sample job descriptions. And I'll talk about that more in detail later in the presentation when we're talking about some new resources. Now, it's important when you're looking at sample job descriptions is you're not going to find another job description out there that's perfect for you. You can just say, we're going to take this. We're going to just copy and paste it. This is it. But you will get a lot of ideas. You'll look at other job descriptions and say, oh, I didn't think of this for this particular environmental health position. This is great. Let's add that. Or phrasing. Oh, look at the way this job description, characterizes this. Look at the phrase they use. That's so much clearer than what we were using. So it's really great to sort of set your brain on fire and make some synapses going in terms of what you can include in job descriptions. The same goes for job postings. And job postings are particularly helpful if you're looking at a job that's kind of new, a cutting edge job for public health. So for example, a lot of health departments this past year or couple of years have hired for the first time data modernization staff. Where do you start with data modernization? Well, if you look at the websites for job postings, you'll find that other health departments are posting for data modernization. So you can get some ideas that way too. Now, job postings are different than job descriptions, but they do list the kinds of things that the job will be responsible for. Now, the Public Health Accreditation Board's accreditation standards and measures are an excellent resource for your job descriptions. If you've applied for accreditation, or you're going to apply for reaccreditation, or even if you're not interested in accreditation, the requirements for accreditation are there not just because somebody thought it was a good idea, but because they've been tested and used, and they're sort of state of the art. They're good for health departments to do. So just for example, if you're writing a job description for an environmental staff person, look at the FAB standards and measures around environmental programs, and you'll get some really good ideas. Oh, we should be doing these things in our health department, so we should be including them in our job descriptions. And I'll talk later a little bit more about how you do that, how you make sure that the accreditation requirements are in your job descriptions. And then I just sort of mentioned the core competencies for public health professionals. And I'll talk more in detail about them, but they're another good resource for getting ideas of what you should include in your job descriptions. And then for certain jobs, there are going to be some specialty kinds of jobs. Hold on, let me, for example, that are more technical, if you're hiring for an epidemiologist, there are some specific competencies out on the internet related to EPI or DIS. So there are some specialty competencies that you want to look at as you're developing your job descriptions. So next slide. These are the URLs for the sample job descriptions, and you don't have to hurry and copy them down. You will receive access to this slide set, so you can access them later. But those are the 3 that are current. And then, as I said, PPHA will be uploading another set. And the next slide, please. And these are the links for the job posting sites. And you'd be surprised, clicking on the link for, using Indeed. A lot of health departments do use Indeed. So besides the national associations, Indeed is another good access to get job postings. Next slide. So now let's talk about the job description and its format and what it should include. So every job description, obviously, I hope, should include the job title. And then we recommend that you include a summary statement, a short paragraph that defines the position, it describes the position, and it sets the context and the tone for the next part of the job description, which is, and we recommend a bulleted list of essential responsibilities or functions or duties. These are the things that the person in this position, these are the essential things that they do, and the qualifications for anyone in this position. And then optionally, you can include the core competencies for public health professionals. You can include KSAs, the knowledge, skills, and abilities, and you can include physical demands. And there are some pros and cons to including all of those. So next slide. So this is just a quick screenshot of what a sample job description will look like in the PPHA site. I just wanted you to see, the title. I wanted you to see the short paragraph that is the summary or job description. And then we have a bulleted statements of what are the essential duties of this job. We're not going to walk through this. This is just the first page of a 2 or 3 page job description. But I wanted you to see what the summary statement looks like. Next slide. So let's talk about the summary statement a little bit. As I said, it provides the context of the job. It provides the context for all of those bulleted essential duty statements of what are those about? What are they for? So you can use this paragraph to tie the job to the department's mission of creating community health. And we have an example of that. You're not just doing A, B, and C, but these are creating health in the communities that we serve. It summarizes the role. And when you're developing the summary statements, you want to make sure that you exclude the details of what should be included in the essential duty statements. I've seen some summary statements that include, details. This person will do X, Y, and Z. This is a general description of the position. And you don't want to include some things that you might want to include in a job posting. Job postings are different. They're external marketing tools. So in a job posting, for example, you are going to include your mission statement because you want people to know, but you don't need to include it in the job description. Next slide, please. So here's a sample job summary statement. I'm sure it can be written different ways, but here's a sample. The environmental health manager. So right away, as you're reading this and you're looking at the job description right away, this is a management position. From the Wholesome County Health Department is responsible for ensuring a healthy environment for the county's residents. So right away, I'm not just inspecting things or citing people for violations. This is responsible for creating a healthy environment for our residents in the communities and the jurisdictions that we serve. So it's really important in terms of the department's mission. And this job is going to be doing that by preventing, mitigating, and containing environmental health hazards. So that gives you the topic area and what you're going to be doing. And then a little bit more specific, the manager ensures that entities and individuals in the county understand and comply with environmental health related laws, regulations, ordinance, and codes. So this tells the reader that this isn't just citing people for violations, but there's an education component to it. You're going to be responsible for making sure that entities and individuals understand with what they need to comply and why they need to comply with them. Next slide. So after that introductory statement that provides the context, you're going to develop that bulleted list. Well, where do you start? You start with what you need in your health department for this position. But then I really suggest that you just do a little bit of research on the internet about the special subject matter, even if you're already a subject matter expert in terms of maternal and child health or environmental health or tobacco cessation. It's just a good idea just to Google it, find out what's out there. What are other people talking about in terms of this subject? It sort of broadens your perspective. It might give you some additional ideas from what you're working with right now because you're focused on this job description in your program. So I really suggest that you kind of look broader and out on the internet. And then, as I said, you're going to borrow from other job description samples and postings, consider the accreditation requirements, ensure that the key concepts of public health that are important for your health department are incorporated into that essential duty. So if social and structural determinants of health are key to your health department, you're going to want to make sure that within that essential duties list are responsibilities around addressing social and structural determinants of health. Next slide, please. Here are some sample essential duty statements. The first one is manages, so you know it's a manager position. The development of the department's branding strategy, so you know it's a communications sample essential duty statement, but it's very specific. This person is responsible for that branding strategy, which, by the way, is a requirement for FAB accreditation. Provides client referrals to other county departments and/or social service agencies of needed services. This is probably a clinical setting, and the person who's looking at this job description knows that this person is going to be aware of clients' needs and their services, and then referring them to other agencies or social services. Conducts enforcement, inspects, and employs corrective actions in accordance with the department protocols. This is where you get a little bit more specific, because you want to be sure that the person in this position does what they do specific to the department protocols. And the last 3 bullets of this slide include that. Transmit timely and complete case reports through appropriate systems. So it puts the person in that position on notice. We've got these protocols, we've got these systems, and these essential duties have to be done in accordance with them. So next slide. Thanks for advancing the slides. So let's talk about the qualifications, the KSAs and the physical demands. The qualifications, I think, really is something that should be included on every job description. It has to be job specific. So whether it's maternal and child health experience, or emergency preparedness experience. And again, you want to make sure that the qualifications, as well as the essential duties, but that the qualifications are equitable across the health department. So you don't have a requirement for a master's degree for this community health educator, but a bachelor's degree for that community health educator, if they're on the same level of responsibility. And you're going to want to use uniform language and wording across the department to make sure that they are equitable across the department. Now, the knowledge, skills, and abilities, some health departments want to include those on their job descriptions, which is fine, and others don't, which is fine. Some health departments have separate documents for the KSAs that they use for other purposes, for example, performance evaluations. But some health departments want them in the job description to show what are the knowledge areas and the skills and abilities that the person in the position has to have to be successful in this position. Now, some health departments want to include physical demand categories, others don't. If you do, we suggest, and if you include it in one, you need to include it in all of them, because you want a standard format across the health department. And we suggest that if you do, you use the ADA 23 physical demand categories for uniformity. They're very specific. They include walking, they include sitting and keyboarding. So they're very specific. But this is just a little recommendation that when you include the physical demand categories, that you really be careful about it, that you really think about what's required for this job. For inspector, someone who's inspecting septic tanks or new buildings or restaurants, clearly they will need to stoop, they'll need to crawl, they'll need to bend over. But for another job that's maybe more of a desk job, do they need to walk? Can they do this from a wheelchair? Maybe. Do they need to have close visual acuity, or is there assistive technology out there where someone that does not have close visual acuity function perfectly well in this job. I worked with a health department in Massachusetts. The person was legally blind. She was a program coordinator. She was very effective. She used assistive technology. She was a super person, very effective and successful in her job. Next slide. Thank you. So here are just some sample qualifications. For an epidemiologist, you maybe want a master's degree, and you want a master's degree in epidemiology, and you want them to have some experience. You don't want, and these are all your judgments. You want someone with experience. And maybe it's not that important that they've worked in a health department. Maybe they've worked in an academic institution with their epi work, and that's okay. But you want to say that. So you want to go back and look at the essential duty statements to say, what does a person need to have or know? What kind of qualifications they have to perform these essential duties? So some examples for a communication specialist, maybe they don't need a master's degree. Maybe they need a bachelor's degree, but maybe there are a number of different areas in which that bachelor's degree could have been obtained: public relations, journalism, marketing. And again, you may want some specific experience, minimum of 3 years, professional experience. And then, as I said, you go back to the essential duty statements and you see, oh, the person in this job really, because of the essential duties that they will be fulfilling, really needs to have some experience relative to social media. So we're going to include that as a qualification requirement, that they have experience creating and managing social media accounts. But maybe it's not that important that they've worked in public health and healthcare if they're really strong on communications. So these are all judgments that you make as you set your qualifications, but they're based on the essential duty statements, what you want the person to actually be doing. Next slide, please. And some sample KSAs, knowledge of laws and regulations governing public health disease investigations. Now, in this kind of a case, they may not have to have that coming into the job. Maybe they're coming from another state and they learn after they're in the job what that state's laws and regulations are. But they do need to have it in order to perform this job. Project management skills, de-escalation skills. Again, these may be expanded on once the person is in the job. De-escalation skills may be necessary for inspectors when they have a person they're inspecting disagrees with their findings, or a DIS staff person may need de-escalation skills. And abilities, a couple examples. Ability to interact effectively with a wide range of individuals. An ability to adapt to changing circumstances, priorities, and projects. So we've worked in public health. We know public health departments. There are always going to be a wide range of individuals and changing circumstances and priorities and projects. So these kind of statements, if you include the KSAs in your job descriptions, there may be some statements, and these are good examples, I think, that you want to include in every single job description. Every person in the health department needs to know how to have an ability to adapt to changing circumstances. Next slide, please. So I mentioned the core competencies, and let's just sort of drill down into them a little bit in terms of including them in your job descriptions. For those of you who haven't worked on the core competencies, there are a list of public health competencies that people in public health in general, but specifically in health departments, should have. And they're grouped by topic area or categories that they call 8 domains. So for example, there's a group of core competencies in the domain called community partnership. These are the competencies around community partnerships that public health professionals should have. There's a domain called science skills, one management and finance, policy and planning. Within each of those 8 domains are core competencies, things like in communications, well, you need to be competent at determining communication strategies. Under science skills, for example, you need to be competent at using evidence as you develop policies and programs and services. And then under the core competencies are sub-competencies. And there are 3 sub-competencies under every core competency. And they're by frontline and support staff. Program management is the second group, program management or supervisory. And the third group is senior management or executive staff. So it's important to understand sort of how they're organized in terms of how you decide you want to incorporate them, if you want to incorporate them in your job descriptions. So if you want to incorporate them, we suggest that you stay at the core competency level and not drill down into the sub-competencies, at least at first, as you get used to working with them. I have seen a rather complicated process online somewhere about how to analyze a job around the core competencies to include in the job descriptions. And it's pretty complicated. It's kind of a project in and of itself. So we suggest that you stay at the core competencies level and you look at which core competencies are most critical to the essential duty statements and include a list. And if you do decide to do that, then we suggest that you include some kind of a statement before that list that sort of waffles a little bit, that says, hey, there are 56 competency statements and they're all important. And you may be called on to use them, but in your job, in this job, here's a list of the ones that we think are most essential. Now, as I said, not every health department wants to include the core competencies in their job description, but core competencies, they're very important. Many health departments, maybe most, I'm not sure, use the core competencies in terms of the development of their workforce development plan to assess the core competencies of their staff and to identify gaps, and then to develop the actual plan part of their workforce development plan. So some health departments just use it for that, and maybe some other unique uses. Some health departments include it in their job descriptions. It's up to the health department. Next slide, please. So this is, I think, the really exciting part. I'm going to introduce 4 brand new tools that are available now for health departments as they develop job descriptions. And the first one, next slide, please, is that new set of sample job descriptions that are going to be posted on the PPHA website. And as I said, we need a big shout out to the Delaware County Health Department. These job descriptions were developed working with the Delaware County Health Department. They are based on what the Delaware County Health Department is doing, and it was invaluable working with them. We could not have come up with this set without working with them. We worked with them for months, maybe a year, working through the job descriptions and what should be included. And then we took what Delaware County is using, and they're continuing to finalize them. And we made them generic for this sample set of job descriptions. We took out all the specifics and we changed the wording so that they were generic, so that any health department could access this set of sample job descriptions as a resource for developing their own job descriptions. And all 4 of these sets of job descriptions have their unique features. And that's why it's important to look at all of them as you're developing a job description for X position. Look for that position in all 4 of those repositories of job descriptions, because all the repositories, they're a little different. They focus on different things. They emphasize different things. This set of sample job descriptions is unique in that it does include the accreditation requirements. It includes administrative positions. Some other repositories don't include things like fiscal management and grants management and human resources. This list does. This repository purposefully includes some of the state-of-the-art public health conceptual frameworks. like structural and social determinants of health and the concepts within Public Health 3.0. It does include a list of core competencies for public health professionals, and it does include the job physical requirements. So next slide, please. The second new resource for you is a guide to developing public health department job descriptions. So if you've gone online looking for guidance about how to develop job descriptions, you found some tip sheets and maybe 2 or 3 pages on this consultant's website, and Indeed has some guidance about how to develop a job description, but you don't find much, and you don't find anything really specific to public health departments and public health department job descriptions. So based on our experience and all of the information that I've talked about today, we've developed a comprehensive guide to developing public health department job descriptions. I think it's about 20 pages. It includes everything that I've covered today, but more detail, more specifics. So that's a brand new tool for health departments. Next slide. So this tool, we're really excited about. I think you'll be really excited about. It's a tool for you to make sure that the Public Health Accreditation Board standards and measures for accreditation are included in your job description somewhere across your department. So what it is it's a table, and it's an extensive table because it includes every single measure and required documentation in the FAB standards and measures for accreditation. So this is just one row of that table. And on the left-hand side, you see some sample essential duty statements. Now, you're going to want to tailor those specific to where the job is vertically in your organizational chart. But generally, what needs to be done is included in that essential duty statement. And these all relate to measure 2.2.3a. If you've worked with the FAB standards and measures, you know, A is for, it pertains to all health departments versus maybe just local health departments or state health departments. And this measure is to maintain and expedite access to personnel and infrastructure for surge capacity. So we know right away that this relates to emergency preparedness. Now, the essential duty statements relate to what's required for that measure. So if you've worked with FAB and the standards and measures, you know that they will require specific documents. They want to see written specific documents. They call them required documentation that they use to assess whether a health department actually meets this measure or not. So for this measure, the first piece of document that they want to see is an inventory of equipment and infrastructure that exceeds what the department's capacity is in the case of emergencies. So we've included a sample essential duty statement that says someone is responsible for maintaining that inventory. So whether you're interested in accreditation or not, or you're going through reaccreditation or initial accreditation, you know someone in your health department that has been assigned to have that inventory of equipment and infrastructure. And the second required documentation under this measure is FAB wants to see a protocol for the maintenance and expediting of access to staff and infrastructure when surge capacity is needed. So it's a good idea somewhere in some job description across your health department that someone be assigned the responsibility of developing and then of implementing that protocol. And the third piece of required documentation that's required is an expedited administrative procedure for use during an emergency event. So it's a good idea to have that assigned to someone, some job description across your health department. So you can use this to look at what are the required documents for accreditation and make sure that the topic areas of these example essential duty statements are included somewhere in at least one, maybe more job descriptions. So if we could have the next slide. So this table that I've been talking about is not organized by measure. That's why it's on the right-hand side of the table. It's organized by topic area. So, for example, if you're writing a job description for a new communications staff, you can go to the communications part of this table and find the FAB measures that relate to communications. And communications is spread all over the standards and measures. So you'll see, a requirement for this kind of a risk communications plan and a requirement for some other kind of communication someplace else. And some measures appear in multiple places. So if you look at communications, you'll see the measure, for example, related to a community health assessment. Because the communications staff are responsible for making sure that the public is aware that there's a community health assessment and they know how to access it. So the community health assessment appears under the communications sample essential duty statements, but it also appears under community health and population health, because the lead staff person for that assessment is probably going to be someone in community health, that they work with the people in the community and engage the community and decide on what focus groups need to be held and help organize that. So it appears under community health and population health. But then the measure that requires a health assessment is also obviously under epidemiology, because you're going to need some epidemiology skill sets for pulling data, analyzing data, presenting data for your community health assessment. So this is how this table is organized. You figure out what the job is that you're developing. You look for the topic areas, and then you can find the sample essential duty statements. We did include a few essential duty statements that are not specifically required by FAB. They're in italics. And for example, the standards and measures don't require that you have an accreditation coordinator. But if you apply for accreditation, FAB requires that the health department appoint an accreditation coordinator to fulfill these functions. So we included in this table some essential duty statements for the accreditation coordinator that relate to the FAB's guide to accreditation coordinators, guide to selecting accreditation coordinators, and what FAB wants the accreditation coordinator to do. So next slide. So the last of the new tools that will be provided on the Pennsylvania Public Health Association's website is a short presentation of a set of PowerPoint slides for health departments' resource staff to use as they talk to other folks in the health department, other health department staff. And it includes some of the things that I talked about today in terms of what is a job description and why it's important. But it also includes some placeholders. There's a slide that says this is a placeholder for you to upload your health department's format or template for a job description. So it's developed to be used by health department staff and to be customized for their health department employee. So those are the 4 new tools. And if I could have the next slide. Again, thank you so much for advancing the slides. This is my last slide. In summary, so I hope we all know it's really important for the health department to have up-to-date and current job descriptions for all their employees, to make sure that they're current. And again, we suggest maybe during the annual performance evaluation time, you just look at the job description, you date it, you say who was the final approval, and you always date it. And as you're developing job descriptions, you need to match it to the actual expectations of your health department. It has to be customized and revised. It's going to be unique to your organizational chart. A lot of health department organizational charts look the same in some ways, but they look different in other ways, because your health department is a little different, because your community and your community needs are a little different. And the job description has to be unique if you're part of a government. If you're part of a city government, for example, there are probably going to be some requirements from the mayor's human resources department about what the job descriptions have to include. If you're part of a state government, it's probably going to have to comply with the state civil service system requirements. If you're part of a local health department, it may need to be approved by the state health department. So it's got to be unique to your situation. Please provide some flexibility in the job descriptions. We know that when we hire a staff person or we've been hired to work in a health department, we may end up doing something different than what we were initially hired for in an emergency or a new grant. So provide some flexibility within those job descriptions so that you don't run up against someone saying, well, that's not my job description. I'm not doing that. So include some flexibility. And then, as I said, we really suggest that you review it annually. It's critical that you keep it simple, that you keep the statements short and concise, make it easy to read, that someone can look at this job description, read the summary statement, cruise down through the essential duty statements, cruise through the qualifications, and if there are KSAs, cruise through that, and then go back and look at it in more detail. But make sure that it's concise. And again, there is no one perfect job description out there for you. It's got to be tailored to your health department. So use multiple examples. Don't just look at, for example, the PPHA job descriptions that are going to be posted, or the Region 5 set of job descriptions, or the different postings. Don't just look at one. Look at multiple ones. I know, working with Delaware County, when I looked at multiple ones, I got some really good ideas from a variety of resources. So use multiple examples. So thank you very much. I hope that you're excited about this topic as I am. And I hope I left some time for some Q&A and, or more importantly, some discussion.
Robin, thank you so much. I know in one of the first slides you poked fun at, job descriptions might have historically been looked at as not the most exciting topic, but I genuinely feel excited hearing you describe just the potential that this has to give partners peace of mind. If you have a suite of job descriptions that have all of the essential public health services accounted for, all these fab standards and measures, that's a beautiful gift. And so just want to commend you, Robin, for all the wonderful things that you have done to put this together. And another shout out to our Delaware County partners who brought this idea to the table, and we're just incredible partners to work this through with over many weeks to put something really special together. So that being said, I haven't seen any initial questions come through the chat, but want to give a moment to see if anyone does have a question. Feel free to drop in the Q&A or the chat as well, and we have a few minutes that Robin can answer. While folks might be thinking on their questions that they may or may not have, did want to reiterate that we will get Robin's wonderful work posted on our Pennsylvania Public Health Association website, and we're going to be spreading it more broadly as well. We've actually been working closely with the Region 5 Public Health Training Center and our partners at the National Network for Public Health Institutes to amplify this awesome work to a national audience. So we'll make sure to make all of those links available to you all once we have those posted. Yeah, and we're really
Also, if
excited.
anyone has any additional thoughts, they've been working on job descriptions, and maybe there's something that I missed, or another recommendation, or if there's something you disagree with that I said, we could talk about it.
Love that. Thanks so much, Robin. I'm seeing you get some love with the reactions, and I see folks still on the line. I don't see any questions coming through, but once again, too, if there's any questions that come up for folks for Robin, feel free to email them afterwards, too, and we can make sure to connect all the dots for anyone as well.
And if I can be of any assistance, just feel free to contact me. You can contact me through Audrey. Get a hold of me if I can help. Just talk things through or write something up for you, whatever.
Brilliant. Well, I guess to close this out, if we could go to the previous slide for just one more moment, Hayden, I'll give just a brief shout out to this slide too for anyone who is either in Pennsylvania or just a supporter of our work in Pennsylvania. We encourage you to scan that QR code. There's membership information. You can also visit our website, Instagram, and Twitter accounts, which I know we're kind of opening up new lines of social media as well. But yeah, if you want to stay connected, learn more about what we do, or at the least, keep the website handy for when we post those resources later on. Just want to call that out as well. That brings us to our last slide, which is simply a call out to this work being made available from, once again, the network of wonderful partners through the FIG network, with obviously support from CDC in the background, PHMC, NACCHO, PPHA, and of course you all for making it possible to have a webinar series. So thanks so much, everybody, and we look forward to hosting our next webinar next month. Date and time to be determined, but we'll make everyone aware. We'll be talking about another wonderful product that Robin's developed, a retention guide for health departments. So specific programs that can increase retention of the amazing employees that we have. Um, so yeah, thank you so much, everybody, for joining us.
Thank you so much.